Hello, this is Andrew Kolsky with Stop My OCD. And today we're going to talk about a very important and sometimes confusing subject, sexual orientation OCD. How do I know if I have it? Well, let's take a look. First, we need to take a look at the definition of OCD. A basic definition is that OCD is an anxiety disorder, and it is experiencing unwanted intrusive thoughts or urges, which are called obsessions, that generate anxiety, followed by the use of rituals to try to reduce or eliminate the anxiety, called compulsions. And that's true and fair and accurate. I have my own definition, however, that I think is a little bit more on point. And in my experience, I believe that OCD is really more of a thought disorder, and you'll understand why in a minute, that causes an individual to repeat a thought action loop, beginning with obsessive doubt, supported by irrational thoughts, that they will act contrary to their core values, leading to feelings of distress, followed by compulsions to reduce that distress. That's a lot of words, but it'll start to make sense as we get into the next couple slides. So let's start off with some definitions. First, we have to understand uncertainty. And uncertainty says, I do not have enough information to judge, but I can get it. So if I were to say to you, did you pass that test you took today? You'd say, well, I'm uncertain. I don't have my grade yet. But eventually I will get that grade and I will know whether or not I passed my test. If I said to you, what time does the restaurant close? You might say, I don't know, I'm uncertain about that, but let me call them and find out. And that would satisfy the uncertainty and make you certain. The next is a definition of the word doubt. Doubt is when you have all of the facts, but you just don't believe them. So if you call the restaurant and they say they close at 9 p.m., if you're doubting that, you're saying, well, I know they said they close at 9 p.m., but for some reason, I don't believe that. I want to go there myself and check it out. And our third definition is obsessive doubt. And obsessive doubt is continuous rumination about having all the facts and not believing them. So when you get into OCD, we're going to talk about obsessive doubt. So let's look at the OCD process itself. In the OCD process, we start off with the here and now. And the here and now is what's happening in front of us today. We can have some kind of a trigger that triggers our next thing here, which is an obsessive thought. And those things occur in the here and now. Now, also in the here and now, we have factual information that typically we can judge by our five senses. We can see, hear, taste, smell, or touch something. So if I were to say, I have this thought that my hands might be contaminated, well, I can take a look at them and I can tell if I see grease or color or something on my hands. I can smell if they smell like there's something on there. I can feel maybe my hands are sticky or something. So I can use my senses to determine whether or not my hands might be contaminated. But then we have another part of the process, which is the OCD cycle. And in the OCD cycle, we start with obsessive doubt. Now, there's that definition we just had. We have all the information, we just don't believe it. When we have obsessive doubt, we then worry about the consequences of whatever that doubt may be. Because of those consequences in that doubt, we start to feel distress. And in order to address the distress that we're feeling, we go and we do a compulsion. So this is the cycle that we get stuck into. When you start off with obsessive doubt, you're going to feel the distress because you're thinking about the consequences, and then you're going to do a compulsion to make yourself feel less distress, and you're going to just keep going into that circle. So normally, when we are dealing with the OCD process. We talk about how do we treat that. And one of the things we can do is we can focus on the distress and the compulsion part of the cycle. And that's where we do exposure and response prevention therapy. Secondly, we can focus on the difference between the here and now and moving into the OCD cycle, where we move from the facts that we have that we know exist in the here and now over to obsessive doubt, which is based upon, I call it the OCD lexicon, words such as maybe, possibly, could be, might be, but we don't have any actual facts to support it. So that's where we focus on doubt reduction therapy in my practice. So as we understand the OCD process, now we have to understand values. So in a contest between obsessive doubt and values, our underlying values are always going to win. So for example, if I had harm OCD and I said, wow, I wonder whether I might stab somebody who comes into my home. I better put away all my knives. I don't want to stab them. I have this obsessive doubt that possibly, maybe I could stab them. But my underlying values tell me that I am not the type of person that would ever intentionally harm someone else, definitely not stabbing them. And in reality, the values are where reality lies, and I would never stab them. OCD makes me want to think that I would, but I would never do it. So because we have this clash between what OCD is saying through the obsessive doubt, you might stab somebody, and then my actual values, which are, I know I would never stab anybody, we get this clash, and that clash causes us to have the distress that we feel in OCD. Okay, let's define sexual orientation now. Sexual orientation is about who you are attracted to and want to have relationships with. Sexual orientations include gay, lesbian, straight, bisexual, and asexual. So this is who you are attracted to, all right? Now let's look at that different from gender identity. Gender identity is one's innermost concept of self as male, female, a blend of both, or neither. It is how individuals perceive themselves and what they call themselves. One's gender identity can be the same or different from their sex assigned at birth and their sexual orientation. So you could have someone who was born with male genitalia, but identifies as female. And that person could also have the sexual orientation of straight, gay, whatever. It just depends. They're two different things, gender identity and sexual orientation. So sexual orientation OCD deals with the sexual orientation part of this. Sexual orientation OCD, formerly referred to as homosexual OCD, sexual orientation is a more accurate and correct and appropriate term. It's a type of OCD that is characterized by intrusive thoughts and compulsive behaviors around a person's sexual orientation. Sexual orientation OCD will not affect your actual sexual orientation. So OCD may say to you, you're straight if you're actually gay, or you may be gay if you're actually straight. And whatever OCD tells you is not going to change the fact that you're either straight or gay or whatever it may be. So there's some people who are confused and they're not clear of what their sexual orientation is or what's going on. So some people are still working to identify and understand their own sexual orientation. That's okay. Everybody goes through that phase at some point of their life. It's a natural process and occurs for everybody. You may discover that you're gay, straight, bisexual, or even asexual. Eventually, that will come to you. Well, how do you know? Well, you can determine your sexual orientation by determining which gender you are attracted to and prefer to have intimate relationships with. Attraction will reveal itself normally during development. If you're not sure right now, that's okay. Eventually, you will know. Some people may feel confused as they are still developing. This is okay. Just be yourself and give it time. There's no rush to find an answer. Some people may know their sexual orientation, but fear it due to social stigma. That's something that's different. So they know what their sexual orientation is, but they don't want it to be that way because they feel that society will look down upon them. Well, but what about if it was sexual orientation OCD? Well, if you're having obsessive doubt about your sexual orientation, you could have sexual orientation OCD. But remember, OCD causes you to doubt your knowledge of who you really are. The clash of obsessive doubt and your own knowledge of who you are causes the distress that leads you to perform compulsions. So that's what I was describing when I was showing you the OCD cycle. In order to feel that distress, it happens because you have that clash between what OCD wants you to believe, which is not true, and what you know to be true, which is opposite. So is there a test? Well, in a way, I've developed one that I think is pretty accurate. And in order for SOOCD to be, for you to have SOOCD, three things must be true. One, you have obsessive doubt about your sexual orientation. So that's, remember back to the OCD cycle, we start with that obsessive doubt. Two, you know that your sexual orientation is different from what the obsessive doubt is telling you. And three, the clash between the two causes you distress. That's the test that I believe is appropriate to show whether or not you have sexual orientation OCD. Well, let's take a look at something else, though. Let's look at the definition of anxiety. And anxiety is a condition brought on when uncertain about some fact or facts, resulting in a feeling of distress. And let's remember, obsessive doubt is continuous rumination about having all of the facts and not believing them. So anxiety, you're uncertain about the facts and you feel distressed because you don't know. Obsessive doubt is you do know the facts, but you don't believe them. So if you say to me, well, but I don't know my orientation, then I might say, well, you may have regular anxiety. And in order for you to have regular anxiety, two things occur. One, you're uncertain about your sexual orientation. And two, your uncertainty brings on feelings of distress. Well, that was our definition of anxiety, right? So that's okay. It may be anxiety because you're not sure yet. So let's compare sexual orientation OCD to anxiety. OCD is based on obsessive doubt. Obsessive doubt comes from not believing what you know to be true. If you do not know what your sexual orientation is yet, then you can't have SOOCD because you can't meet the definition of obsessive doubt. Once you do know your sexual orientation, you could technically develop SOOCD. It's relatively unlikely. Sexual orientation and SOOCD are two different things. Sexual orientation is who you are. SOOCD may be something that you have. One does not cause the other. So who's affected by this? Well, SOOCD can affect anyone. Straight people may have SOOCD based on the obsessive doubt that they may be gay, which they are not and will not become due to SOOCD. Gay people may have SOOCD based on the obsessive doubt that they may be straight, again, which they are not and will not become due to SOCD. Well, what if I am gay or bisexual? Well, being gay, bisexual, or asexual simply defines your sexual orientation. You're a normal, healthy human being. There is absolutely nothing wrong with you. If you need resources to learn more, you can check out www.glad.org. For additional resources, you can visit stopmyocd.com and learn all about all types of OCD. You can also join our free OCD support group, and you can get a link to our YouTube channel where you can learn more from videos like this one. Thank you for visiting, and I hope that clarifies the issues about sexual orientation OCD.